Today's presentation is all about what to do with loose skin. As a behavioral health and fitness coach, I have seen a lot of women move through 50, 60, 70, 80, 90, 100, even 110-pound weight loss. And with that comes loose skin, particularly in the abdominal area, in the thighs, and in the back of the arms. The older we get, the less forgiving our skin is in terms of elasticity and collagen. So when we lose a significant amount of weight, when we have multiple pregnancies, when we go through aging, we're going to see a lot of loose skin. Here is my presentation on what this is all about and how I have seen my clients address this in really great ways and not so great ways over the course of the career in my private practice. So let's dig right in. First and foremost, let's normalize it. This is a photo of my loose skin on my stomach. I have had multiple pregnancies. I have gone through significant weight loss, and I'm in my 40s. So as a result of these combined factors, this is biology. It's not a flaw and it's not a failure on your part. It's totally normal. Our bodies stretch, they expand, they shrink, and they survive. So loose skin is really just the next chapter. And there are things that we can do to improve this. So first and foremost, I want to start with the analogy of the couch. And when I present the couch to you, I want you to visualize a couch. Maybe this one looked like the one in my grandma's house, actually. Over time, the couch, the stuffing in the couch is going to get a little bit flat. And as a result, the fabric on the outside of the couch cushions is going to get a little saggy and a little bit compromised. So this is essentially what happens if we take the stuffing out of the couch, which in this analogy is going to be our body fat, then naturally the paperiness and the looseness of our upholstery or our skin is going to become visible. So our job is to come back in and restuff that couch with as much lean muscle as possible. This is essentially what a body recomposition is. It is reducing body fat and it is increasing lean muscle so that we get that nice perky shape back to our couch. The second analogy that I want to share with you is the Japanese ham sandwich. So in this analogy, your skin is the bread, the mayonnaise is your collagen, the cheese is your body fat, and the ham is the actual muscle. Over the course of aging and with different traumas that occur to our body, what happens is that collagen layer, that mayonnaise, it actually becomes a little bit compromised. So it doesn't do as good of a job as sticking the skin to the body fat into the muscle of your body as it used to. Whereas if we had adequate collagen in our systems, it would have that effect of really bringing the bread closer to the rest of the sandwich and it wouldn't create that loose sensation. So I want you to think of both of these analogies as we go through the rest of this lesson and just keep it in mind. So first things first, hydration and nutrition have big moving levers when it comes to loose skin. That's why we drink half of our body weight in ounces of water daily. So if you are 140 pounds, you're going to drink 70 ounces of water. I personally like to use electrolyte blends like Ultima Passion Fruit is probably my favorite flavor. It really incentivizes me to drink water. I fill up a huge canteen in the morning that's insulated and it's with me for the whole entire day. Next thing is protein consumption. So we want to eat about 0.8 to 1 gram of protein per pound of our goal body weight. I know that this is tricky for a lot of people who aren't used to it. So one thing I want to mention here is that lean proteins are really the goal. Many of my clients will come to me and they've been increasing protein in their diet, but it hasn't been lean protein, so they're getting a surplus of calories. So they're not only building lean muscle, which is the whole goal of high protein consumption, they are in fact building body fat as well. So making sure that we do eat about 1 gram of protein per pound of our ideal body weight or our current body weight if we are within normal BMI range, and making sure that that protein is lean. Next up, hydrolyzed collagen peptides. So the most important for loose skin are types 1 and types 3, and we want to make sure that we're consuming adequate vitamin C so that we can absorb the collagen. Not all collagens are created equal. Ancient Nutrition's vanilla flavored collagen is my favorite. It's available on Amazon, and it has all 5 types of all 5 types of collagen peptides. This is important because as much as type 1 and type 3 are kind of the beauty collagen, the other types 2, types 4, and types 5 will actually help joints, tendons, ligaments, and other soft tissues in your body. Next up, we come to the nutrition part of the conversation. So making sure that we are supplementing with and consuming omega-3 fats. This is going to keep the lipid barriers in your skin nice and supple. And we also want to be making sure that we consume adequate zinc and copper from our whole food diets. Collagen needs zinc and copper to actually cross-link collagen fibers and be able to work effectively. So I get a lot of my zinc and copper through whole food supplementation of shellfish, nuts, seeds, dark chocolate, and organ meats. When it comes to muscle hypertrophy and skin tightening, this is all having to do with the couch analogy that I shared. So we want to build lean muscle underneath the loose skin or the loose fabric of the couch. We want to focus on glutes, quads, hamstrings, core, and shoulders. So really that trunk and those large muscle groups. These muscle groups are big, they're structurally centered, and they carry a lot of our body's shape. So when we engage in hypertrophy in these particular muscle groups, it is very helpful to perk up the skin and give us an overall tighter aesthetic. We need to be training each muscle group 2 times a week with a progressive overload. Otherwise, you will never achieve that hypertrophy that you're looking for. We also need to make sure that we are consuming adequate calories and protein. We will not grow muscle if we're in too much of a caloric deficit, and you certainly won't be growing muscle if you don't have adequate protein. Next up, skin lasers and RF treatments. So I've had a lot of clients that don't want to go the surgical route after massive weight loss, and they will opt for skin lasers. You're going to get probably about 40% of the effect as you would like a tummy tuck from what I've seen. I consulted with Dr. Sasha Hu on this when I was considering addressing this issue for myself. I decided not to go with it based upon the results that I saw from former clients that underwent a similar thing. The cost benefit that I found with a procedure like this didn't personally appeal to me, but this is a option for individuals who maybe don't mind the cost of it and have a large preference for a non-invasive treatment, even if it's not as efficacious. So with anything, when we are treating topically, we can weave in things into our skincare routine that are going to help tremendously. I'm really bad about skincare in general and a skincare routine, but I know some clients that I've served are really good about applying topical retinoids and making sure that they're adding that in as part of their tight skin plan. Okay, so let's move on to tummy tuck options. There's a lot of different tummy tuck options. These red lines show the incision line for different types. The ones that I have seen most commonly in my practice are mini tummy tucks, full tummy tucks, and fleur-de-lis tummy tucks. So these are going to differ for a few reasons. A mini tummy tuck doesn't have as large of an incision, and I have seen where the belly button has not been compromised. I don't know about y'all, but one of the reasons that I have really shied away from getting a tummy tuck myself is because the belly buttons can look funny. So a mini tummy tuck can be a really great option. It's not as invasive, and oftentimes they don't really mess with your belly button. Now, what should be said about this is if the papering of the skin is above the navel, if you want a tightening above the navel, this is not going to be the best option for you. But for those who are just worried about the sagging skin down in the lower abdomen, this can be a good solution. The full tummy tuck is the most common one that I have experience with my clients. It will remove skin above and below the navel and often includes diastasis repair. So in the abdominis recti, these six-pack muscles, many of us have even a small separation in that center line. And with a full tummy tuck, the surgeon goes in and they suture the abdominal recti back together. Last but not least, we have fleur-de-lis. So this is I have seen 3 clients go through a fleur-de-lis tummy tuck. This is going to be the most impacted surgery and is the most appropriate for massive weight loss skin removal. When clients that I've served have lost 80, 100, 110 pounds, this is the one that's most advised. It has a anchor shaped scars, so the recovery time is a lot more serious, but the results can be pretty incredible. So let's talk about that belly button. Your navel actually will stay attached internally, and it's really the artistry of the surgeon that is going to make or break the aesthetic of this result. So I really encourage my clients to get second, third, fourth, fifth opinions from their plastic surgeons, ask for a lot of examples of how the surgeon deals with the belly button, and this can make sure that we get the results that we're looking for. Okay, so last but not least, I want to talk about the emotional side and the bottom line here. Body image disconnect is real. At the end of the day, I support surgery in the case that what bothers you, it compromises the way that you see yourself, and that identity piece kind of outweighs the risk and the downtime of the surgery. Surgeries can be expensive and they can have a lot of downtime, and often the results, even if done very naturally, you can see that there's been some work done. So if your loose skin bothers you to the extent that you're considering work done, then you should absolutely consult with surgeons. I don't think that there's any moralism when it comes to this. However, there is also some acceptance and some mindset work that can be done to address this if you're not too sure, or if you're kind of on the verge of making that decision for yourself to go under the knife. At the end of the day, all routes are valid, whether you get surgery, whether you don't get surgery, whether you address this behaviorally through nutrition and exercise science to the most that you can, and then after that point, deciding to go under the knife. All routes are valid. At the end of the day, we have to choose what makes us feel confident and comfortable. So, doing the hard work to undergo massive weight loss, to have multiple pregnancies, or just manage age as we go along, there is a spectrum between holistic remedies such as hydration, nutrition, and hypertrophy, all the way up to surgery. I tend to be of the mindset to intervene behaviorally before we intervene medically or surgically. And in this case, I would coach anyone who has loose skin to see how much they can achieve that tightening that they're looking for through nutrition, supplementation, and exercise means. And then once they have gone to the max there, see if they're satisfied with those results or if they're looking for a little bit more. And if you are, reaching out to get various consultations from different surgeons.